underwent endoscopic L4 L5 discectomy.
एक मिनट, is it case number 2, right?
Yes, sir. Originally it was case number 2, but we are taking as case 4 now.
नहीं नहीं,
Pehlad.
हाँ, carry on.
Yes, sir. So patient underwent endoscopic L4 L5 discectomy in 2019. Then, but his developed recurrence of symptoms, lower backache radiating to bilateral lower limb, but his symptoms is more towards left side only. He also got 50% sensory loss in left L4 and L5 dermatome. Otherwise, his power is normal and reflexes are normal. On MRI, we can see at L3, L4 level, partial narrowing is there, and at L4, L5 level narrowing is more towards L4, L5 level. So,
Dr. Dureja is there?
sir, doctor.
There seems to be a little bit of far lateral disc actually, if you see on these L4-5 levels.
Yes.
Dr. Dureja?
Sir, yeah, he just gone to the washroom, sir. Yes, sir, he has come.
So what we